Hi everyone, I'm Jackie.
And I'm Jessica. We work at the Peer Group in Florham Park, New Jersey. Today we're going to be doing a live video of some CoolSculpting. This is our patient Tina, and we have already gotten Tina marked, and we have the gel pad on. We take photos prior to starting, and after the treatment is complete in about 4 months, we do some post photos again and kind of compare them from side to side. So just a little bit about CoolSculpting. CoolSculpting is a fat reduction procedure that uses cold, and it uses cryolipolysis, which kills the fat cell, and then the fat cell is excreted through your lymphatic system. So once the dead fat cell is there, your body sees that dead fat cell, the macrophages eat it away, and it's just excreted naturally. Things that help to improve it: drinking a lot of water, staying well hydrated, avoiding Advil and aspirin is helpful afterwards because you want that immune response. How you doing, Tina? Good. All right. So we're going to get started. We're going to put the applicator on. So this is what the applicator looks like. The inside is all cooling, and it's going to use suction and draw her tissue into the device. So I'm going to put the suction on. How's that feel? Good. Alright, so then we position it with the little boppy, kind of keeping it in place here. And I just make sure that she's comfortable before I start the cold. So when I start the cold, some patients feel cold and others feel that it's so cold it feels hot. Everybody is a little bit different. After about 5 to 10 minutes, the majority of patients, the area goes numb. And then for the rest of the procedure, they're comfortable. This is a 35-minute treatment. We do have the newer applicators. The older ones were an hour every time it was placed on. So now that I know she's comfortable, I'm going to start the cold. And you'll notice that we have 2 machines here at the peer group, and that enables us to do dual sculpting. So on areas that do not compete with each other, like the flanks, the little muffin top, we can do an anterior and a posterior at the same time, and it decreases how long you need to be here. There's not many facilities that have 2 machines in northern New Jersey. We are one of them, though. How does it feel? It's getting cold. Getting cold? Okay. So sometimes it could feel a little pinchy when it initially goes on until that area goes numb. And she'll let us know when it feels numb. Typically when you have this treatment, we
Try to make you really comfortable. We have a nice relaxing room, as you can see here. We have Netflix, we have some snacks, we can order you lunch. We really try to make the experience as pleasant as possible.
After the 35 minutes is up, we then take the applicator off, we massage the area for 2 minutes, and then for about 5 to 10 minutes after, the area is very achy. It feels almost like you've been outside with your hands in the snow. You come in, they feel hot and achy. After 10 minutes, that sensation goes away. You can be tender to the touch, you could be bruised. The tenderness, and it could also be numb, could last a couple weeks. It's not that you would be aware if you weren't touching your skin. It definitely is a tactile discomfort. So feel free to send your questions in, and we'll do our best to answer as much as we can.
Let's go over the rules again. Don't forget that there is a prize for the winner if you are a candidate. It would be 1 cycle of CoolSculpting, which is a $750 value. In order to have CoolSculpting, depending on what areas, you would need more than 1 to treat areas. The best thing is to really come in and let us assess you, pinch around, see if you're a good candidate, and then go from there.
Yeah, we need the tissue to be pinchable because it draws into the machine. If you're very tight, it it's not going to get a good draw. So as far as being a candidate, the best thing is just to come in and we do free consultations, and we can let you know what a good treatment plan would be for you. How's it feeling?
Tingly.
Tingly? Okay. Bearable?
Absolutely.
Do you like
So let's see if we have any questions. How about some questions that most people ask during the consultation? I know a good one I usually get is, do you get any weight loss with CoolSculpting?
So typically there is not weight loss. Fat does not weigh a lot, so you're not going to see the scale move. It takes up a lot of space, but there's not a lot of weight behind it. This procedure really is for contouring. It's that stubborn area that you have that no matter what you do, you go to the gym, you can't get rid of it. That's going to be the patient that gets the best result. Because it's about a 25%, up to a 25% reduction in the area, if you're very overweight or your BMI is more than 30%, that's not going to be that much. So for that fit individual that has just that little pocket, this is probably the procedure for you. What else?
Another good one is, when do you start to see your results?
So patients will start seeing results around 3 weeks, and they'll see them up to 4 months. Once you get to the 4-month mark, pretty much what you see is what you get. Again, everybody's a little bit different. We give 3 weeks as a guideline. It could be a little less, it could be a little more. Because it relies on your body is the reason why it is a range as the percentage. Because everybody's body responds differently, and everybody's immune response is different. So I always caution patients that have a lot of autoimmune diseases that they may take longer to see results, or results may not be as good as somebody who has a healthy, normal, functioning immune system.
That's another question. Who wouldn't be a candidate?
So if the area is not pinchable enough, if it's more of a tight fat that is not going to get drawn in, we wouldn't treat you. We wouldn't treat you if you have any sensitivities to cold, obviously. If you have a hernia in the stomach, we do not want to treat over a hernia or any recent surgery or scar. We usually say for surgery you want to wait at least 6 months before having this done.
We've got our first question.
All right.
So this is from Jim. Jim's asking, how many times can you do CoolSculpting to one area?
So areas can be repeated. If you know right off the bat that you want more than that 25% reduction, then we can schedule it as early as 6 weeks to do the area again. If you're not sure, then we tell most patients to wait till you're out 3 months, and then you kind of have a better idea of what the results are going to look like, and then from there decide whether you want to retreat, but areas can be retreated.
So after the procedure, when can patients resume their normal activities? What's the downtime, limitations, restrictions, things like that? That's a good question.
So really no downtime at all. I've had the procedure done myself. I've gone to the gym the same day. That being said, I didn't do abs after having my abdomen done, but you're able to do anything. There's no restrictions as long as you're comfortable doing it. You just kind of go by yourself. We encourage you to continue your exercise and diet regime, because this is not a quick fix. This is not for somebody who's going to have it done and think that they can go out and eat whatever they want and wind up gaining 10 pounds. Those are the patients that are going to come back and not be very happy. So, not a license to eat. This works in conjunction with dieting and exercise to do your part.
I have another question. This question is from Little Haley. On the abdomen, does the applicator go in the center of an area to be treated, and does it suck an area in pretty evenly?
So that's a really good question. So everybody's treatment plan is going to be a little different. I would say the majority that we do, the applicators are in a diamond pattern, kind of overlapping each other. Because the technology works, you really need to cover the entire area that needs to be treated. When the tissue is drawn in, when I place it, I'm placing it at the peak of a bulge. So the center of the applicator is going to be the coldest, and that's what's going to get treated the most, and then it's going to taper as it goes off. As long as I know that I have the entire treatment area covered, we're fine. Now there are some very fit women who just have a little fullness on the lower abdomen, and their upper is very tight. They have abs on top, just that little lower pooch. So for those women, we can use a different applicator that's called Cool Fit. And it really was made for fit individuals. And I would do that 2 side by side, up and down. So again, the center, you're going to put the peak of that bulge right at the center of the applicator, and that works really well for them. We also have a Cool Max applicator, which is double the size of the one that we're doing today. So for somebody who's larger, and it is more of a debulking applicator, so even though we say that we really don't want to use it for that, there's some patients that know no matter what, they don't want to have surgery, and they want any improvement.
Show them.
As opposed to nothing.
So this would be the Cool Max.
On how that goes.
And this is the CoolSculpting applicator that we're using now, and this is the Cool Max.
So I hope that answered your question as to the placement and whether it evenly distributes. Typically, I do not take one applicator and place it across the lower abdomen because you are going to see where that applicator ended. Most people do not have a peak of the bulge right underneath their belly button. It's usually one on each side. So I don't think I've ever treated somebody in that fashion.
What about, since we're talking about this, what about other areas? What other areas can CoolSculpt treat?
Okay, so there are several FDA approved areas. The abdomen, the flanks, which would be the muffin top, the chin. We also treat underneath the bra area, the little bra roll. Outer thighs, which is a different applicator. It doesn't use suction, it actually straps on. Inner thighs. And now they just received approval for arms. So we actually are the only company in northern New Jersey to already have the arm applicator. We were treating arms, but it was considered off-label. And the new applicator is a different size and really fits patients a lot better. So somebody who has previously been here and told that they were not a good candidate to have their arms treated, I would definitely recommend coming back and be reassessed because this is really a game changer for CoolSculpting. And
Looks like we have another question.
okay.
This question is from Shannon. She wants to know how long do the results last?
So once that fat cell is gone, once it's excreted, it's not coming back. So as long as you don't gain weight, you're not going to see an increase in that area. Now the remaining fat cells, if you are to gain weight, could get larger. But if you maintain your weight, the results are permanent because you're actually killing and removing the fat cell from your body. So a lot of times with this, and even with liposuction, we'll see patients that'll say, oh, I had CoolSculpting on my stomach and then my back then the fat traveled to my back. Well, fat doesn't travel, it's not going to go anywhere. It's just that now you've gained weight and you're going to notice it in an area other than the abdomen.
Let's remind everybody now's a good time to like and share and tag the video. This way you'll be entered in for a chance to win the free cycle. So don't forget to like and share. And if you have any questions, that'd be great too. We're here for 35 minutes.
So how's it feeling now?
I feel nothing.
Nothing? Okay. So the area is now numb. If we were not in here bothering her during this, she has a TV in front of her. She'd be watching Netflix. She'd be on her phone. We have patients come in that work, they bring their laptop, they're sitting comfortably. Typically, we're not in the room the entire treatment. We wait until the patient gets comfortable, and then we'll leave. The patients have a little call bell. If you need anything, they just buzz us, and we come in and take care of them.
Show them the gel pad?
Sure.
So this is the gel pad that we use to protect your skin. It's kind of gooey and sticky, but it definitely protects your skin during the procedure. It goes on underneath the applicator before it starts. So you can see here, it's nice and gooey, slimy, gets everywhere, but it protects your skin during the procedure.
So immediately following, again, she could be bruised, she could be swollen in the area. That's all normal. As far as how long it lasts, depends on how much bruising and swelling you have to begin with. We really don't typically see it too much with abdomens, more on somewhere that's not as pinchable. So like the back, the bra area or flank area. And again, with time, that goes away. It's going to be a little tender to the touch, a little numb, and that can last up to a couple weeks.
So about how long are each procedures? If you're doing, say, a chin treatment or an abdomen, are they different amounts of time?
Yeah, so the different applicators that we have are different amounts of time. The Cool Smooth, which is the one that straps on, is an hour and 15 minutes. So areas that I would treat typically are lateral thigh, and it's somebody who's very fit, and I'm treating their lower abdomen. But they're not pinchable enough on the upper. I'll do a Cool Smooth on the upper, and then I'll treat the lower. I don't really like to treat just one spot without the other, because if you are then to gain weight, you're going to notice it in that area. So you may then notice fullness in the upper abdomen. So I do like to treat the abdomen as a whole. So that's an hour and 15. Then we have the Cool Mini, which is the chin applicator. We can show you that. So this is the size of it, and we treat patients right underneath the chin, and that's on for 45 minutes. And the way that the chin treatment works is you would come in, you would have the treatment done, you would come back a month later, and we retreat, and we do that for almost everybody. Now, there are some patients like myself that are too narrow for this applicator. If you notice, it kind of lifts on the side. And for those patients, we kind of do side-by-side, overlapping in the center. And with that, I don't necessarily retreat in 30 days. Then we would wait and see the results, because it is getting that double in the middle.
So this is what the Cool Mini actually looks like. This is the size of it. If you want to just give a little demo on how you place it, depending on the size.
Yeah, sure. So patients actually have this little headrest pillow that once we have the applicator on, either like this or from side to side, we use straps and we kind of strap you in. The hardest part with this is you're not going to be able to talk while it's on. So you're going to have to just do thumbs up, thumbs down. So staying still sometimes it is an issue, but once it's done, again, within a couple weeks, you start seeing the results. Now, I know a lot of patients ask if there is skin tightening with the CoolSculpting. So there is not. So this is going to get rid of fat, but it is not going to tighten the skin. So if there is laxity in the skin, or if somebody is on the larger side and we're doing the debulking, the max applicators, I do tell patients that they could find that they have some more laxity in the skin afterwards. And some patients are fine with that. You know, they just want the bulk down, they don't care about the excess skin. And really, right now, the best thing for that would be surgery. So if somebody were against surgery and didn't care, that the skin could become lax. And we see it more with the abdomen, medial thighs, arms. Those are all areas where it doesn't tend to really tighten up as well. I've had some patients though, and they came back and their skin was definitely tighter. So again, because it's an immune response, your body is sending a lot of stuff to the area, so everybody's...
You want to explain the Cool Smooth, how it's different from the other applicators that we have? Sure.
So this is what the smooth applicator looks like, and this is for what they call saddlebags. So it would be like that lateral thigh, and we have the patients lay down either on the stomach or on the back, depending on where the majority of the pocket is. And we use a series of straps, and we're pretty much just strapping the applicator on. Again, because it's not suction, because it straps on, it does stay on longer, an hour and 15 minutes. And I don't think I finished that last question. All of the other applicators, aside from the mini and the smooth, are 35-minute treatments. Again, they used to be 60 minutes, but the machine has been advanced, and now you're only there for 35.
And do we go through what areas that you can dual sculpt? Meaning do two at a time to make
Yeah,
it quicker?
so the dual sculpting can be done, again, in areas that don't compete against each other. So a stomach, you're not going to be able to dual sculpt, but flanks, the bra area, we can do both machines at the same time in that 35-minute treatment. Lateral thigh, the new arm applicator, which is not only going to be used for arms, it's also somebody who has a smaller bulge on the medial thigh will use it. So you'll notice the difference. So,
You can show them over here.
so that's the difference in size of the two.
Show everybody how it would be placed.
Okay, so the way that this applicator would work is you want to find where her bulge starts and kind of where it ends. So when I use this applicator, you'll notice putting it all the way up to the top, she still has some fullness here. So my treatment plan for her would then be to come down, and then you're going to overlap that in the center. And you'll notice it's heaviest right here. So we would do run treatment here, and then another here, kind of protecting that ulnar nerve. And again, smaller abdomen, somebody who's very petite, that would be a good option for them. You feel comfortable? Absolutely. All right. So we have 14 minutes left. So continue to send your questions in. Like us, share us, and in order to win, get into the raffle.
Want to explain our consultation process? It is complimentary. We have you come in. How do we do the assessments? What happens at the assessments?
Yeah, so once patients come in, we bring them into the room. We have our little templates, which are different sizes depending on the head that we're using. So we're going to pinch at you. It's probably the worst part of the procedure. So we pinch at you and make sure that you're pinchable enough to draw into the machine. And then we just use our templates and kind of devise a treatment plan for you.
Do you want to explain what templates we use?
So this would be the one that we would use for either the upper abdomen on a super fit patient or the lateral thigh. Again, I want this entire area to be treatable. So if you have a little tiny fat pocket that's only this big, if I'm putting this applicator over it, I'm over treating. So that would not be a good patient for CoolSculpting. So this is the size. Again, the center is the coldest, but I don't want to put this down on an area that's going to then go into something that you'll see where the applicator ends. These are our cores, which we use for the abdomen. So that would be the 4 that I told you about. There's also, depending, every patient is a little bit different. For the most part, the flank area, we do curves. And that just has, you'll notice, just a little bit more curve to it. So it just kind of holds it when you kind of come across this area. Typically, most flanks start at the back, and then they come towards the front. There's very few patients that it's just one in the back to get that muffin top. But by doing where the fat roll starts, which is usually right back here, you'll do one treatment there, and then the other one's going to overlap, and it's going to wind up overlapping right in the waistline, which just really helps to bring the waist in. And this is our max applicator. Again, a larger patient that is going to pull it all in. And this has the petite. So they're different sizes, and again, this would be for a very tiny abdomen. You would use this applicator, and this would be either for the arms, medial thighs. You could even do a fit on the abdomen as well. I don't know if you want to show them the photos. So even then, you get this done.
Another question I frequently get asked is the procedure safe?
Yes, so the procedure does have FDA clearance, so it is safe. With these newer applicators, we're seeing a lot less discomfort after. The older applicators, patients would complain around day 4 or 5 that they had a lot of nerve pings and pangs. We are not seeing that with the newer applicators, not even as nearly as close as we were with the older ones. Again, the suction is less, it is a little bit colder, but it was really the vasoconstriction of the tissue on the sides of the panel that was causing patients a lot of discomfort after. So for the most part, the procedure is really getting a lot more comfortable,
And about,
as you can tell.
And after the procedure, what do you expect to feel?
So there could be numbness. You could be sensitive to the touch. A lot of times I'll tell patients to wear something a little compressing afterwards, just because it feels better. Again, if you're swollen and walking around, it could feel like it jiggles because of the swelling. So wearing something compressing just kind of holds everything in and gives patients a little bit more comfort.
Is there anything patients should do prior to treatment to prepare for the day?
There's really not. We tell patients just to wear comfortable clothing when you come. Again, you don't want to be wearing tight-fitting jeans. I found that the first couple days after I had it done, whenever I would sit down in the car, I wanted to unbutton my jeans. So, it is tender. But other than that, you're just going to drink lots of fluid. The reason I do tell patients not to take a lot of Advil is so that would be ibuprofen, anything that has an anti-inflammatory effect, because we want inflammation. We want your body to see this injury and go after it. That's part of the whole immune response. So if you have a headache after and you need to take something, I usually recommend taking Tylenol instead. Some patients have asked if they can take arnica, which helps decrease bruising and swelling. I have no issues with that. I have patients who use the arnica gel. I do think the product works well. Again, we're not seeing as much bruising as we were with the older applicators, but feel free to do that as well. If you're taking fish oil and a lot of blood thinners, take a lot of Advil, again, your risk of bruising is just going to be that much more.
So what about side effects? Have you discussed any side effects with CoolSculpt?
So the side effects there could be, one of the things was late onset pain. So late onset pain was developing in patients mostly that had the max. So that's the big debulking one. Around day 4 or 5, they would feel an intense nerve pain. Here we would have one of the doctors see the patients. We would have them start on Neurontin or Lyrica. If we were to do nothing, the pain would go away in a couple days. The Neurontin or Lyrica really did help to kind of get them through those couple days. I have to say, with the new applicators, I have not seen it at all. There's also some side effect of the area actually getting larger. Now, that being said, I think it's 0.0093% of the population being treated does this happen to, but we do like to tell you that ahead of time. There is the risk of developing a hernia because it is using suction and drawing your tissue in. If you have a weakness and you're not aware of it, and now we're putting suction onto it, you could have a risk of developing a hernia.
Which again is another reason why we do these consultations, to find out who is a candidate and be safe for and effective for. So I'm just going to throw this out there. Don't forget to like and share. More likes, more shares, more chances of winning the free cycle. Again, it's a $750 cycle. If you're a candidate, of course.
And just for anybody who checked in a little bit later, we're doing a live demo of CoolSculpting at the peer group today. And how are you feeling?
Okay.
All right, so she only has 6 minutes to go left in her treatment. Once I take the applicator off, I massage the area for 2 minutes. That can be a little uncomfortable for patients, and the area feels achy. Almost feels like you've been outside with your hands in the snow. You come in, they feel hot and achy. That sensation can last for about 10 minutes. Once the massage is done, if you were a patient here, you would get a break. You would be able to get up and use the bathroom. Obviously, once the machine is on, is not a good time to stop. Once we start the cycle, we get to the point of no return where we cannot stop it, so without losing the cycle. So we just make sure everybody's comfortable prior, and however much time you need in between each cycle will allow.
So another question that I have is, what's the difference between liposuction and CoolSculpting? People do ask.
Oh yeah, so liposuction is obviously surgical. It is going to get rid of 80 to 90% of the fat in the area. CoolSculpting, the percentage is up to 25%. So that's a big difference. If you come in and you have a big belly and you're looking to be flat, this is not the procedure for you. This is not going to change your weight. It's not going to change the size of clothing that you're wearing. It's just going to smooth you. It's going to get rid of what hangs over your jeans. It's going to get rid of that back bulge that you can see when you have a tight-fitting shirt on. I would say that that's the biggest difference is the percentage of. So you really need to think about what your end result, what you're looking for as an end result.
How long have you been doing it?
So another question we get is, how long have we had CoolSculpting at the peer group? How long has it been? Since it came out? About 4 to 5 years, would you say?
It's been about 4 years now.
And maybe what are the most common areas, or how many cycles would be a common female or male patient?
I would say the majority would be 4 cycles. Abdomen, most patients is 4 cycles. The flank, the muffin top, most patients is 4 cycles. Again, if it's just lateral thigh, obviously only 2. Medial thigh, usually just 2. But it will change a little bit depending on the size of the patient and the area that they're looking to treat. So feel free. Any questions that you have? We only have 3 more minutes to go.
So that's the warning bell. In 3 minutes, the machine will come off, and then we're going to do the 2-minute massage.
there were some Harvard scientists that realized that children who were sucking on popsicles all the time were losing fat on the inside of their cheeks and developing dimples, and that women who were riding horses on an ice-cold saddle were losing the fat on the inside of their thighs. So these guys took this information and started thinking about it and looking into it and realized that it was the cold that was causing these fat cells to die. So the history is pretty long with them thinking about and developing and coming up with the science that backs this up.
If you have any more questions, now's the time. Again, like and share, more chances to win. We'll go over and show you the massaging and how the CoolSculpt machine comes off.
Any questions? This was a piece of cake. Good.
So we have another question. They want to know if it's long-term for the results.
Yes, the results are permanent. Obviously, if you were to gain weight, you're going to notice it in another area rather than the area that you had treated. But once that fat cell is dead, you have less fat cells in that area. So any type of weight gain, you'll see somewhere else other than the area being treated. I've had patients come back and, which I do not recommend, gaining 10 pounds, and the area that was treated, you could still tell a difference. So the cycle has ended, so I turn off my suction. And we just put a little warm washcloth on there.
So
And we use our timer.
How are you feeling?
Okay, it's a little tingly.
So we have a couple questions rolling in. Someone wants to know, Darla wants to know, do you have to do it numerous times in the same area?
No, you don't. If you just have a small exercise-resistant area, one treatment that if you get 25% reduction, then that's really all you need. You can go on our website and see some before and after photos, and it'll actually say whether they had one treatment or numerous. Now, that being said, I've had patients come back and say they really wanted more than that 25%, or they wanted another area, and that's fine. It can be repeated. How you doing?
Okay.
So we have a question from Mercedes. She probably missed the first half, but she wants to know, Mercedes wants to know, how quick do you see the results?
So you're going to start seeing results around 3 weeks. Obviously, everybody's a little bit different. I kind of give that as a guide. Usually by 3 weeks, you're seeing results. And you'll see them up until the 3 to 4 month mark. Once you get to 4 months, pretty much what you see is what you get. So our 2 minutes is up. The area is pink, as you can tell. She has some markings on here. As we make sure everything is marked prior to placing it. And that's it. So now we'll go on with the rest of her treatment plan. I hope you guys found this information helpful and see that it's really no big deal. She's taking a little time off of work today and improving on herself.
So if you have any other questions, you can always call the office. Our number is on Facebook and also our website, but it's 973-822-3000, or you can check out the website at puregroupnj.com. Feel free to also Facebook message. If you're too shy and you don't want to ask a question, that's fine as well. But again, like and share, more chances to win. Thanks for joining us.
Bye.